Hey, good day, class. I'm not sure what time you're going to watch this, but what I thought I'd do is do a really good review of the axial skeleton and get into the appendicular skeleton shortly thereafter. And that way, you guys can prepare for a quiz for next week that we're going to have. And I think this is going to be a good review for you guys. And then when we meet on Friday at 3:30. We'll actually answer any questions. I'm going to show you the uh, the pictorial quiz that I'm going to be using about half the time, and we'll discuss assignments and so forth. And I'll leave you with some homework. And that's about it. Let's get into the axial skeleton. Okay, what we're going to talk about is essentially the skull, the vertebral column, and the rib cage today. So here's your axial skeleton. This is just a review what we covered last week. So it involves just what you see right in through there. But what it doesn't involve, and this is probably a good test question, is what don't you see there? Is the clavicles. You don't see the scapula. So it just involves the skull, just what you see pictured here, the ribs, sternum, the costal cartilages, the lumbar vertebrae, the sacrum, the entire vertebrae from cervical all the way down to the lumbar, and the coccyx and the sacrum. So there you go, you have it. So let's get into the skull. And the skulls are mostly flat bones. As you can see here, this has been bivalved for you to see all the different parts and pieces on the inside. We talked about sutures that are immovable joints, but some of them are movable at the early stages. And those fontanelles close at certain time frames. When an infant is born, the fontanelle in front actually closes at 1 to 3 years. And there's sphenoid, and all of these sutures come together and form to protect the skull. So this is called a calvaria. I don't know if you've seen an autopsy before, but it's essentially they cut right in through there, open up the skull, and remove parts of the brain for examination. And we'll go ahead. That's what it looks like. It's not quite clean. It's not as clean as that if you've ever been to one, but this is for training purposes. All right, this is what you're going to need to know. These are the bones that you're actually going to need to know for your exam. Anything that I mention here have colored, you'll need to remember. We're covering the frontal portion, the parietal portion, and actually the posterior portion of the skull. We'll cover the frontal portion here in a few slides. But know where the ethmoid bone is, know where to identify it, the sphenoid bone, frontal, parietal, temporal, and occipital. As you can see, there's a number next to it that represents how many bones there are. It's they're on both sides. So the parietal again is on both sides, right? So here's your sphenoid and ethmoid superior view. Okay, that was that bat-looking structure I showed you last week. And I want you to know where the sphenoid and the ethmoid bone are at. And the ethmoid bone is right in through here. Okay. It involves the cribriform plate and the crista galli. Don't remember those names, just remember where the ethmoid bone is. And remember that the sphenoid has a lesser wing and a greater wing, and what it's shaped like. And I would suggest that you get into the netters. I have an atlas in the resources. And when you start going over these, do a deep dive into this and see how far you can go, and look into the anatomy, what it looks like. Some of these pictures could be better. And so we'll go ahead and continue going. The pictures will get better as we go on. So here are your cranial bones. right? So there's 8 of them. You got your parietal bone, your temporal bone, your sphenoid bone right in through there. And as we go to the front of the face, you got your zygomatic bone right here, colored in turquoise. Our maxilla, that's purple, okay? And we have our mandible right there on the bottom, okay? That's our jawbone, all right? And remember the ethmoid bone and the sphenoid bone, you can see them from the outside. We just showed you the inside, but now you know if you see a picture like this, you know that ethmoid bone is right in through there, okay? Yeah, so let me take a look at the back. Know where the mastoid process is? What I'm pointing at right in here. We touched it last week. We did a little surface anatomy, and I showed you where it was. And, you know, there's a lot of good points in there that we use to relax people. And let's see. Yeah, know where the zygomatic process is. Not just the zygomatic bone, but the zygomatic process right here. Okay, right in through there, that little bridge. That bridge right there serves a purpose, okay? And there's a lot of acupuncture points we use right in through there. This is a frontal view. Again, you can see the sphenoid bone and the ethmoid bone. Ethmoid is very barely visible. It's kind of pointing you in the general direction. So from whatever angle you see the skull, you should be able to identify these, okay? Right, we've already covered all of these bones. So I also want you to know where the glabella is. The glabella is this feature right in here. Here's the glabella, and the feature is actually right there. It's like right on the bridge, right there, okay? There's also some foramens on top. You don't need to know those for the test, but I want you to know where they're at. You may have some extra credit questions on that. And also know where these mental foramens are. Mental foramens are just right below your incisors, right down below on your mandible. Okay. Here's the inside of the skull, if you were to bivalve it in half. All right. You can see the pterygoid process of the sphenoid bone is visible in pink, right in through here. All right. Your sutures are marked, right? I want you to know where the coronal suture is. Even if you saw it bivalved, you should be able to. All right. And let's take a look back here. Yeah. Nasal bone for sure. It's common sense there, right? And that's it for this slide. Okay. I want you to know everything on this slide. Everything on this slide right here. So this is, if you were to mark a slide, I want you to know everything on this one. And anything else I mentioned on the inside. All right, your parietal bones, right? This is the upper view, the skull. Here's your occipital in the back. And there's a lambdoidal suture here, sagittal suture in the middle, and your frontal bone. Okay, from the back side, you can see your lambdoid suture. All right, your parietal bones sit just having, and the sagittal suture is right up the middle. Know where your external occipital protuberance is. This is the protuberance. This is actually going to be used as a marker for some of your acupuncture points, either on the left or right side, or right above it or right below it. And we'll get into some dew points and UB points and some other points that you'll be using in and around there, and you'll be palpating these areas to actually find points in the near future. All right, let's get to the next slide. If I hand you a slide like this with nothing on there, I want you to be able to identify the foramen magnum. I want you to be able to identify the maxilla, the zygomatic bone, and the temporal bone as part of the zygomatic process. Again, the zygomatic process. All right. Just another quick look at it. This is giving you another what I did when I was going through acupuncture school. I found a lot of these online, and I would just print them out without any identifiers on them, and I would draw my own lines to them and check it against the PowerPoint, and that's how I studied. And I also looked into atlases and things like that to get a better understanding of, when they start to describe an acupuncture point, especially out of CAM, that you should be issued. A lot of the test questions from Kale, especially when it comes to point identification, what they are, where they're at, they all are related to a geographical location somewhere on the body, using these terms, these long medical terms. And, we're going to associate ourselves with that. And, this vocabulary, this medical vocabulary, and the body parts and anatomy go hand in hand with Chinese medicine because they wrote the book and they used English to publish that book. Gives you a better look at the sphenoid and the lesser wing and the temporal bones. Okay, this is a better picture. We covered this last week. This is just a review. All right, body is sphenoid. And that's about all I want you to know. But I do want you to know where the greater wing is. Here's your ethmoid bone, little tiny sucker, right? Know where that's at. So that little piece fits in right in through there. It's kind of hard to orient yourself. There's better pictures of it you can find on the internet, but it will help you orient how that would actually fit as a piece of a puzzle, inside the bone. So there it is there. I guess your crista galli, your pointy edge and your pointy bottom, your perpendicular plate would help you orient it. That way, if I showed you a picture like that upside down, you kind of, turn it and kind of visualize how it goes into that piece of puzzle. And that's what you need to do with everything. You need to orient. When you're learning anatomy, you're learning where the nerves go, when you're studying embryology, all these things, you got to orient and draw pictures and have a good understanding of, like it starts off with anatomy, and that's the anatomical position. Everything starts off from there, right? Again, just another picture. All right. So here's some of your facial bones. Know where they're at. It's kind of cool. There's two nasal bones. Not a lot of people know that, so that's kind of A good thing to know is that they're split in half, right? Say they're bivalve right there. Don't worry so much about the palatine. And yeah, the maxilla split up into two bones. The mandible is one piece. So if I were to ask you a question, how many maxilla bones are there? You'd be able to tell me, right? Here's your zygomatic, right? There's two of them marked in green. All right, a lot of information. I mean, it seems like it's easy because it's just pictures, but you'll be surprised a lot of the stuff, if you don't anchor it and don't do a lot of studying, what ends up happening is that it starts to pile up and you won't be able to get caught up. So make sure you stay on top of this. Get in the books. A lot of this course is about self-study. I'm just introducing you to different parts, and when we get into the muscles and the organs and stuff, we'll get into it a lot more. But this is kind of setting the standard and setting the baseline of where to attach everything, where everything goes. Okay, so here's your body of the mandible. I want you to know where the ramus of the mandible is. I want you to know where the mandibular angle is. All right. The mandibular condyle and the coronoid process, which is just this piece right here, and on this side too. Okay, don't worry so much about mandibular foramen. I know where the body is, mandibular angle. All right. All right, know where that glabella is. This is one more orientation for you. All right. All right, let's take a look at inside, starting with your frontal sinus. All right, right in through here. You've got your nasal bone up front. And then there's a perpendicular plate of the ethmoid bone. And remember where that pink part is. Okay, what is that a part of? Don't worry so much about the alveolar margin. I didn't mention vomer before, but if you concentrated on the other pictures, it should be the same color. So you should be able to identify its location in relationship to the upper parts of the sphenoid sinus and the top part of the palate, the palatine bone. Okay. Here's a good picture. All right. Here's the palatine bone right there, and the vomer sits right up top. I'm not going to give you any questions or any pictorial questions on this slide. However, just understand where it's at in relationship to everything else. Okay. Yeah, this is some sinuses there. There's a lot of acupuncture points we use when someone has rhinitis, or they've got a cold, they've got a stuffy nose or runny nose, allergies. We stick needles right in and around here, and at B-tongue and different areas, the crease of the nose here, and even up a little higher. And we have points up here that we use near these sinuses. They actually help relieve a lot of congestion and things like that. But these are the turbinates. You understand that we're not going to get into these too much, but I just wanted to show you guys a picture of this. The ethmoidal sinuses are up top, and just superior to the ethmoidal are the frontal sinuses. And of course, you have the maxillary sinus, just you know, a little bit superior and frontal to the mandible and the zygomatic process, the maxilla and the zygomatic process right in through here. Then you have your nasal septum, which bivalves the nose right in through there. So as you can see, right, this is the infraorbital foramen. There's another foramen inside called the optic canal. These are all supraorbital foramens. These are a lot of the foramens they're covering here, and they're in relationship to the roof of the orbit, lateral wall of the orbit, and this is your zygomatic process of the frontal bone. This is your infraorbital foramen, right? This is your nasal bone, all right? So if you can imagine this person, this is his right eye, right? So this is the nasal bone. The hyoid bone, this is a floating bone, sits at about the level of your cervical vertebra 3, third cervical vertebra. It's a couple of functions. A lot of people don't know what it's for. It actually holds the tongue in place, and helps with the larynx, and helps with some vibration. There's a lot of acupuncture points right in through there. A couple of them that I use on patients. Yeah, you got to be careful, but yeah, it's kind of a unique area to have a bone that's not attached to anything. So don't worry about describing any of the greater horns or lesser horns, but that's where it actually sits. They just brought it out so that you can actually see it. Okay, let's go ahead and take a little bit of a break, and we'll get into the vertebral column review. Okay, I hope you enjoyed your break. Let's get into a quick review of the vertebral column. So as you can see, how many vertebrae do we have? Okay, you got C1 all the way to C7. You got T1 all the way to T12. There's 12 thoracic vertebrae. You have 5 lumbar vertebrae. You have 5 sacral vertebrae that are fused. And these holes here you see are actually acupuncture points. And we use all of these. This is a really good, rich area for folks that are having either lower GI issues or menstrual issues or fertility issues or even lower back issues between S1 and L5. There's a lot of folks that have pain in there, and we use a lot of these points that sit right in this groove here in and around, and not necessarily the acupuncture point, but a lot of what we call Auger points, which are just points that are described to get rid of pain, and we palpate around and figure out if there's a release that folks can get from this. And there's also 4 coccyx fused vertebrae down below, right in here. I have better pictures of those in a second. So here's your typical vertebra. So you're going to have to know all of these, right? So what we're doing is we're looking straight down as if we were looking down above somebody. And this is probably, this is probably a lumbar or a lower thoracic. And as you can see, you always know that the spinous process, which is back here, the posterior side, always know that's to the rear. okay? And so that's what I said before, is knowing how to orient yourself in relationship to this bone. The spinous process is always to the rear, facing the rear, okay? There's a lamina that's just if we go in the counterclockwise position, there's a way to remember this. You can come up with your own acronym, but the lamina sits just as you go down this little hill, right? This lamina on both sides, right? Then this big piece here goes all the way across, and that's your transverse process. Okay. Then you have these articular processes right here that allow smooth movement of um, the rib and the upper portion of the other spinal body and the spinal piece that's just above it. And then this piece, the lower piece, if you circle around there, that's your pedicle, right? It's like a post, right, on both sides. And this whole portion is called the vertebral arch, right? This archway. But then it's split up between the lamina, which is up top, and the pedicle down below. And then you have your foramen. Some vertebras that I'll show you later have two foramens, right? And this one only has one. And some of them are triangular in nature, and you can identify that as well, figure out what that is. And then you have your body. This is your whole body of the whole weight-bearing body of this vertebra. Okay, it's got it marked out for you there. So this is your superior articular process. This is your inferior. This is looking at it from the side. And then your spinous process is in the back like a tail. Got to be careful with that because some of the upper spinal processes you can't really tell. You have to actually get it at the right angle to figure out if it is a spinous process. So when you're identifying these, make sure you get your letters out and look at it from all different angles. Yeah, biggest problems people have is identifying the difference between the lamina and the pedicle. They get those mixed up a lot. Okay. So you have your posterior longitudinal ligament, all right? And you have your anterior longitudinal ligament. And so why don't we have anything on the sides, right? It's a defect. It could be functional, but as people get older, where are those slipped discs happening? Okay, normally not through that ligament because it's very strong, holds everything together. Okay, it either prevents hyperflexion or hyperextension of the back, those ligaments, adds additional protection for the cartilages and the bone structure, keeps everything intact. But when you take a look at it, there's a hole on the side. And those holes on the side, when we get osteoporosis and get older and weight bearing and things start to degenerate, this little piece here slips out to the side. It slips out medially and posteriorly. Oftentimes it'll hang right here. And so that's a slip disc, right? And you can catch it on the x-ray and you can catch it with an MRI, but understand that's where the anterior longitudinal ligament is. Okay, it's on the front side, and then your posterior longitudinal ligament is on the back side. Okay. You have spinal ligaments. We talked about the anterior longitudinal ligament. But you have different ligaments that are transversing between the transverse processes. Know that that's the intertransverse ligament. You can see that right here. All right. And you also have the interspinous ligament down here. Okay, it's just up slightly right there. And have the internal ligamentum flavum, which holds everything together, right? And that is actually posterior to the posterior longitudinal ligament. Actually sits inside right there. Here's a good picture of the intervertebral disc up top. Right here, you can see the anterior ligament up front, the anterior longitudinal ligament up front. So again, how can you tell this is the front or the back? Your spinous process is going to be to the rear. And all these articulations are going to be to the rear. So this is your anterior side. You also have foramens that run through, right? And you've got your intervertebral disc. You have your supraspinous ligament that runs just like a, like an amphibian, right? Just like this one sheath that just goes straight down your spinous process. Here's your transverse process right here, goes across. And your ligamentum flavum I showed you on the previous slide runs the posterior side of your posterior longitudinal ligament, and it runs all the way down in between each vertebra on that side. Of course, that foramen that you saw runs right through, the spinal cord runs right through there. All right, and your nerve roots, they come down below in between the vertebrae. Okay, and those are going to become important when we get into the nervous system. But right now, we're just giving you a flavor of where things are at in relationship to the vertebra and the nerve. So this shows you a herniated portion of the disc right up here. See, as it's coming out towards the rear, usually comes out, it comes out kind of medial posteriorly, not so much in the front, but you never know. Your spinal cord right here, as you can see, if it compresses up against there, it's going to affect this spinal nerve root, and depending on what level is going to determine what kind of symptoms this person's going to have. Okay, and here's an obvious, right, spinous process, which is the posterior aspect, and this is your nucleus pulposus of the disc. And when there's a developing embryo, there's certain pieces of the mesenchymal fetal development. There's pieces when it comes to bilaminar to a trilaminar. Later it becomes, you can see it quite faintly, on videos, but it's kind of cool that this whole piece is involved in that at the beginning of development of the child, of an embryo. So here's some weight-bearing stuff that you can take a look at. You have your intradiscal pressures that they've measured in different positions. And as you can see, when we're students, like myself, giving a lecture, now I'm sitting up straight. But you can see that it takes its toll on your vertebra. So this is a good picture and shows a degenerating disc, right? As you can see, it starts to deteriorate. Some of them, you know, fuse at some point. And when they do X-rays, they can see this right away. They can see the normal spacing, all right? And they can tell right away this one here is a thinning disc. This one's not too good of a herniated disc. Oh yeah, right there, right up front. Right up back, I mean, right there. That's a herniated disc. Look how big that is. Yeah, see how it's popped out right in there. So what ligament, know what ligament is back here, right, for the test. Know what ligament's up front. And here's your degenerating disc, right, down below. These are your formations, right? And so let's get into the cervical vertebra. So this is your C1, right? This is your atlas. We talked about last week that it's these articular processes. You know, understand that whenever you see this V, right, this posterior tubercle right here, it's more of a pronounced and heavier. That's always to the rear, right? Understand that the anterior side, if you draw an arrow over these superior articular faucets, it'll actually point towards the front of the body, right? So if you did it this way, it would point away, right? So go back to that. So that's how you could tell if you were to get oriented on a test. You would just draw a straight line this way, draw a straight line that way, and that arrow is the front of the body. Of course, we're cheating now. This is your anterior side, but it's all about oriented where you're going. Your posterior tubercle, okay, right? It's actually a bigger bone in the back. So, and the rest of the spinal column is like that too, right? It's actually, you know, you have larger processes in the back. You have to handle more weight. Okay. So know these parts, and this is your anterior arch. All right. This is your posterior arch. This is your inferior articular faucet, right? And this faucet allows the occipital bone to glide freely, right, to help with articulation of, you know, the neck right in through there. Okay, this piece here is your axis, your C2. Okay, this is your dens or adentoid process, right? When you just slip this, put the atlas right on top of that, right? And you know, these superior articular faucets run underneath this bone here. And so this anterior process sticks up through here and allows your head to rotate around. There's a bunch of ligaments that attach both around this way to prevent forward movement and to limit movement to the left and right. Okay, but I'll show you a better picture of it here. Your spinous process actually is more pronounced on C2 than it is C1. Actually starts to come back and almost form a bifid, little bifid type of structure right here, right? And the pedicles and lamina are more pronounced. You actually start naming them around the C2 area. Again, that's just like a puzzle, just fits right up top, and that dens goes above the C1 axis, and that bone up here spins around to allow your head to make this movement, Okay, and sometimes when these are fractured, I can go over fractures later, but there's a thing called a Jefferson fracture, and there's also a hangman's fracture, and these two bones are involved, right? You can go ahead, we'll do an assignment. I'll put that out um, today, and you'll have to discuss these two bones in relationship to those fractures, what happens, what part of the bone is broken, and I want you to get familiar with the different parts of these two C1 and C2. So as you can see, when you have the adentoid process sticking up, which is your dens of your axis bone, which is your C2, right? It's kind of funny, it sits above C1, right? It's just, and that's what it's for, actually. So this transverse ligament here, right here, can spin around and prevent your forward head of the movement, and allows more strength and stability in that area. So that's your C1 is your weight bearing atlas. When you're holding up the globe, the atlas, right? So that's your C1. Your C2 again is for rotation. So that's a rotational type of situation there. Okay. You have your C3 right here. So if you see an X-ray, you start right up here. You can tell right away if there's a fracture on X-rays. But when you first take a look at it, you want to start and identify where. Sometimes you have to find C1 first because it's more pronounced. And then sometimes C1 is hidden, so you have to kind of go up, and then you might be able to see this piece or this piece here. And that's how you identify them. Say, okay, that's one. You actually can draw right on the X-rays, and then that's 4, 5, 6, 7, and that way you know where T1 starts, right? And as you can see, C7 is the most pronounced spinous process to the rear. Okay, as you can see, C1, C2 actually has a bifid process right here on the axis, C2, all the way down to C6. You'll have a bifid pronunciation right there, a bifid shape. Okay, get it into the thoracic spine. You got T1 through T12. So there's the rule of threes, all right? So the tip of the spinous process is the reference structure for T1 through T12. And T1 through T3, the spinous process is at the level of the vertebra. Okay, so rule of three. So we'll show you a picture of it in a second. T4 through T6, the spinous process is half level below T4. Spinous process is at the level between T4 and T5. So that's the example, right? So it's not quite at the same level. It actually is at the level between T4 and T5. So between T7 and T9, right, that's your third three, is the spinous process at the level of the vertebra below T7 spinous process at T8 vertebral level. Okay, so again, T7 spinous process is at T8 vertebral level. All right, so it actually skipped a half a space, right? T10 is the same level as T7 through T9. And T11 is same as T4 through T6. And T12 is the same as T1 through T3. So it kind of changes up a little bit, but if you could remember the rule of threes, maybe help you out a little bit. It actually takes, in order to understand this and actually get it, get a really good big picture of it and just go through it, write next to it, look at it, do the math, because you're going to be counting spinous processes for the rest of your career as an acupuncturist. So you might as well get used to counting right now, because it's used to find your dew points, your urinary bladder points, okay, your everything in relationship to points on the back. You use spinous processes and thoracic spine levels, and so this is why we're covering this now. Is to actually it'll help you with your points classes, help you with your acupuncture career. Okay, so here's your thoracic vertebra. All right, yeah, your spinous processes are definitely more pronounced. You can see the body is a lot more weight bearing, but not as much as the lumbar. And you have inferior articular processes that articulate with the vertebrae associated with it down here. All right. You have your superior articular processes that articulate with the vertebra above. Transverse processes, we're looking at it at a weird angle. I mean, this one looks like it curves in. It's actually, if you turned it, it would look the same as this. Okay. But there's also right here a costal facet for the tubercle of the rib. So all thoracic vertebra have a costal facet for attachment of the ribs. Okay. And that's all the way from T1 all the way down to T12. So as you can see, rib number 5, it actually articulates at these articular spots in between T4 and T5. So both T4 and T5 will have some space on both of them. Okay? In that rib, the inferior costal facet of T4 and the superior costal facet of T5 will actually articulate with the end of this rib. Okay? So here are your ligaments. This is a really good picture of a ligament that displays the shaft of the rib cage. The rib and ligaments are attaching to this surface of the transverse process, right? And also articulate with the superior costal facet for the head of the rib. Of course, you have the body of the thoracic vertebra, your foramen, your spinous process, always to the rear. Okay? And you have your superior costal facet. Remember where that's at. The anatomy of a typical rib, you've got your costal cartilage up front, right? Followed by your external surface. You have your costal groove that runs underneath this, underneath the rib cage. So what's that costal groove for? Well, I think God was trying to protect our vein, artery, and nerve bundle that runs underneath each one of these ribs. And so that's why when we do a needle insertion, we actually don't needle down below the rib in danger of doing nerve damage or hitting a vein or an artery. So these ribs actually protect that vein, artery, and nerve bundle that runs underneath. So if you're going to do a procedure where you have to withdraw fluid from the chest, you always want to insert the needle on top of the rib and in to the parietal space. Back here you have the angle, and you have a tubercle back here, and then you have your posterior head right in through here. You can see it's going to articulate with actually two different spinous processes, right? Or not spinous processes, but vertebral bodies, whole vertebra. Okay, so the space of that vertebra is actually going to sit right here, right? So you have your jugular notch up top, right? You have your sternal angle. Okay, where's the sternal angle? What's that about? Okay, let's discuss the sternal angle and how you can use that as a landmark. All right. So that landmark is associated with a few things. First of all, it's where your second rib attaches to. But your second rib actually attaches to both the manubrium, okay, and the body of the sternum. All right. Your first rib above it attaches only to the manubrium portion of that. Your sternal angle is level with, if you were to draw a straight line and go through, it's level with your T4, in between T4 and T5, somewhere around there. And it's also a good point when they're doing x-rays, they can find the bifurcation of your bronchus, and a lot of the great vessels start to bend around there. Okay, you have your body, and down below you have your xiphoid process. Okay, so as you can see, the ribs are covered with cartilage, or they're actually cartilaginous. And ribs 1 through 7, if you count down, are actually true ribs. And they actually, all of those true ribs actually connect, right, to what? Yeah, they connect to the sternum, right? Okay, so again, the true ribs are 1 through 7. 8 through 12 are what we refer to as false ribs. And if you take a look at rib 8, right, it's right here. Where does it attach to? It actually attaches to the cartilage of rib 7. Rib 9 attaches to the cartilage of rib 8. And rib 10 and attaches to rib 9. And then the two ribs in the back are floating ribs. 11 and 12, they don't actually attach to anything. They're free floating ribs. Okay, and as you can see, the L1 vertebra has no ribs attached to it. So there's 12 ribs, and T1 through T12, right, are actually, there's a rib associated with each one of those thoracic vertebrae. Okay. All right. Let's take a look at the other pieces. So I want you to know about the sternum, the different pieces of the sternum, manubrium, body, xiphoid. I want you to know that there's intercostal spaces. You'll be using these to mark points. The kidney channel, and there's a lot of points in there. The Wren channel will be used to mark rib spaces, and you'll be able to identify these ribs, be able to palpate the first rib, work your way on down. Some people that are muscular, you have to actually use different landmarks to figure out where everything's at. But you'll do fine. Okay, there's a better picture of the body, manubrium, jugular notch, clavicular notch. So your clavicular notch, right in here, right, this piece right here, so that's where your clavicle attaches to. All right, remember we mentioned where the sternal angle, where those articulate, or where those are level with. And this is the piece, the xiphoid process. So there's acupuncture points all the way up, and even behind this jugular notch, the needle is inserted first almost perpendicularly, and then you angle it off and go in behind this manubrium. Okay, so that's a Ren 22, I believe, right? Ren 22. There's also a popular point that's level with the fourth rib, and that's going to be yeah, see all these faucets here? These are all faucets for ribs 1 through 7 that articulate with the head of the rib. Okay. Right, so if you work your way down to the fourth rib, right, you're going to find right here, 4. You come in here to the midline and you insert a needle straight down underneath the skin, and it scrapes against the body of the sternum. That's Ren 17. Very popular point we use for a lot of different breathing issues, to open them up, a lot of different disorders. And yeah, wow. So it looks like a pretty decent surgery. Looks like they clamp somebody up there. It's going to be after they crack someone's chest open. That's how they clamp them back down. So you have your superior articular process. Just a quick review. Be careful on this. If you're given this on a test, sometimes you can mix it up with a transverse process and call that a spinous process. So make sure you take a look at netters and look at it at every angle. This is your sacrum. And so these holes here, we stick needles right through them, almost routinely, all the time. All right. But those are, this is the body of the first sacral vertebra. These are fused, but you could actually count them, how many of them are. There's 5. One here, 2 here, 3 here, 4 here, and 5 here. All right. And you have your coccyx. All right. You have 4 of those fused right there. Sometimes people have 5. On this side, you're looking at it from the rear. So this is your posterior view, the sacral hiatus. All right. You have these crests here. You have your median crest. You have your lateral sacral crest on both sides. Then you have your superior articular processes. So that's going to be your L5 is going to be rubbing up against that really nice and neatly. All right. Yeah, we stick needles all in and around there, especially at the SI joint, your sacroiliac joint. And so that's a good review of you guys. I decided to use better pictures rather than, get into the meat and all those words. We can, without having too much busy writing, we can actually take a look at the structures. And when we start weeks, I think 13, 14, 15, when we start to do some, look at more cameras, and we can start to do some surface anatomy. We're actually palpating things and doing things like that. And we'll think of a plan to do that. Okay. Well, that's it for today. I want to thank you for paying attention. And we have class on Friday at 3:30, which will review a few things, one of which is the quiz. We'll do the analytics on the quiz. We'll actually get into netters a little bit, show a little bit of netters. And also, what I'd like to do is actually do a little assignment, like a group assignment, and then we'll close it up for the day. All right. Well, thank you very much. Have a nice weekend.